Artificial Intelligence Doctor. User question. Why LPCSP, leadless pacemaker conduction system pacing, is potentially riskier than conventional right ventricular pacing? Claude AI answer. The LPCSP, leadless pacemaker conduction system pacing, is potentially riskier than conventional right ventricular pacing for several anatomical and technical reasons. 1. Anatomical complexity and precision required. The interventricular septum contains the specialized conduction system, his bundle branches, which requires very precise targeting. The septum is thicker and more muscular than the RV apex, requiring deeper penetration for proper fixation. Small deviations in placement can miss the conduction system entirely, making the procedure ineffective. 2. Higher perforation risk. The septum separates the left and right ventricles. Excessive penetration could perforate into the left ventricle. Septal perforation could potentially cause interventricular communication defects. The septum's thickness and density make it harder to judge appropriate penetration depth. Left ventricular perforation carries more serious hemodynamic consequences than right ventricular perforation. 3. Risk to conduction system. Inappropriate placement could damage the existing conduction system, potentially causing complete heart block. Unlike RV apical pacing, where some intrinsic conduction may remain, septal complications could completely disrupt normal electrical pathways. Inflammatory response from device placement could affect nearby conduction tissues. 4. Technical deployment challenges. Requires both fluoroscopic and intracardiac echocardiographic guidance, increasing procedure complexity. The angle and approach through the interventricular septum is more technically demanding. Greater force may be needed for septal penetration, increasing trauma risk. 5. Limited retrieval options. If complications occur during septal deployment, device retrieval may be more difficult than from the RV apex. The septal location makes emergency surgical access more challenging if needed. 6. Less established safety profile. Conventional RV leadless pacing has extensive clinical data and established safety protocols. Septal conduction system pacing with leadless devices is newer, with less long-term safety data. These factors explain why the study used temporary deployment first to evaluate feasibility and safety before committing to permanent septal placement.